What if your body was quietly trying to warn you about a deadly threat, and you didn't know how to listen? Every day, thousands of men miss the subtle but critical signs that prostate cancer may be developing silently. Not because they're careless, but because the symptoms often disguise themselves as minor, everyday issues. But by the time the disease becomes obvious, treatment can be much harder, and the options, much fewer. In today's video, we're going to shine a light on 7 early warning signs of prostate cancer that are too often ignored or misunderstood. These are signs that could be happening to you or someone close to you right now, and yet they're brushed off as age, stress, or just normal changes. Make no mistake, early detection saves lives. And the difference between catching prostate cancer in time and catching it too late often comes down to knowledge, knowing what to watch for and when to act. That's exactly what this video is here to give you. So stay with us. Don't just watch, pay attention. Because what you learn today could one day save your life, or the life of someone you love. And if you care about taking control of your health and staying informed, go ahead and hit the like button and subscribe now. We're building a community that believes in prevention, in early action, and in never taking our health for granted. Now let's begin. From the least obvious to the most urgent, here are 7 warning signs of prostate cancer you need to know. Sign 1: unexplained pain or discomfort in the pelvic region. Let's begin with the most critical warning sign: unexplained pain or discomfort in the pelvic region. This type of pain is often persistent, meaning it doesn't go away with rest or common pain relievers, and it can affect your day-to-day activities. The discomfort may present as a dull ache or sharp, stabbing sensations, and it might radiate to the lower back, hips, or even the upper thighs. Because the prostate is situated deep in the pelvic area, any abnormal changes in its structure, whether from inflammation, growth, or other pathological changes, can result in referred pain. This symptom is particularly concerning because it may be the first noticeable sign that prompts further investigation, even before other urinary or sexual issues become evident. The pain might be subtle at first, easily dismissed as minor strain or aging-related discomfort, but its persistence should not be ignored. Keeping a detailed record of the pain, noting its duration, intensity, and any activities that trigger or alleviate it, can be instrumental for your healthcare provider in diagnosing the underlying cause. Early detection through attentive observation of these symptoms is paramount, as it can lead to timely medical intervention and significantly improve long-term health outcomes. Sign 2: erectile dysfunction. Next, erectile dysfunction, ED, emerges as another significant signal that can be intertwined with underlying prostate issues. While ED is a common condition with multiple possible causes, when it appears alongside other urinary or pelvic symptoms, it may be an early warning sign that something is amiss with your prostate health. This condition isn't solely about sexual performance, it reflects underlying changes in blood flow, nerve function, or hormonal balance that can be associated with prostate inflammation or growth. You might experience a reduced ability to achieve or maintain an erection, or you might notice a diminished quality in your erections, which can understandably lead to frustration or concern. It's important to consider that changes in sexual function are sometimes the body's way of communicating that a deeper systemic issue needs attention. If you observe these changes, particularly if they develop suddenly or worsen over time, it is crucial to have an open and honest discussion with your healthcare provider. Detailed evaluations, including physical examinations and diagnostic tests, can help determine whether these symptoms are linked to prostate health or if another contributing factor is at play. Sign 3: pain or discomfort in the lower back, hips, or pelvis. Persistent pain or discomfort in the lower back, hips, or pelvic area remains one of the most telling, and concerning signs that something deeper may be at play regarding your prostate health. This isn't merely the occasional soreness that fades after a long day or a strenuous activity, rather, it's a steady, lingering ache that may gradually intensify over time, quietly eroding your comfort and quality of life. The pain can manifest in various forms, sometimes presenting as a dull, nagging pressure that persists in the background, other times evolving into sharper, more piercing sensations that disrupt even the simplest daily routines. For many men, this type of discomfort is easily brushed aside, often chalked up to aging, muscle strain, or the wear and tear of an active lifestyle. However, when such pain becomes chronic or begins to pair with other concerning symptoms like urinary difficulties or changes in urine flow, it should set off immediate alarm bells. The reason this symptom carries such weight is tied to the anatomy of the prostate itself, situated deep within the pelvis, close to a network of nerves and tissues that, when disturbed by inflammation or abnormal growth, can trigger referred pain across a broad area. Being proactive is key. Keeping a detailed log of your pain, noting when it arises, how long it lasts, its intensity, and what activities or positions seem to aggravate or ease it, can provide invaluable clues for your doctor. Recognizing and acting on these warning signs early empowers you to seek timely medical evaluation, ensuring that any underlying condition is diagnosed and managed before it progresses. By remaining vigilant and attentive to what your body is trying to communicate, you give yourself the best possible chance at maintaining your health and well-being. Sign 4. Blood in urine or semen. One of the most alarming and unmistakable warning signs you should never ignore is the presence of blood in your urine or semen. This can present itself in several ways, from a faint pink tint, to a more pronounced red shade, or even a brownish discoloration in your urine, as well as unexpected streaks of blood in your semen during ejaculation. While it's true that there are multiple potential causes behind this unsettling symptom, including urinary tract infections or kidney stones, its appearance in the context of other prostate-related symptoms significantly raises the level of concern. What makes this sign particularly critical is its implication that something deeper might be occurring within the prostate or surrounding tissues. It could signal inflammation, an ongoing infection, or in more serious circumstances, the early stages of prostate cancer, a stage when swift action can make all the difference in outcome. Even if you notice blood only occasionally or without any accompanying pain, it should never be brushed aside. Prompt evaluation by a healthcare provider is essential, as they can conduct the necessary diagnostic tests to identify the root cause and guide you toward appropriate treatment. Paying close attention to when the bleeding occurs, how frequently it happens, and whether it's accompanied by pain or discomfort can be immensely helpful for your doctor in making an accurate diagnosis. Remember, the body often gives subtle hints before a condition worsens, and it's those who listen carefully who stand the best chance of protecting their long-term health. Early action is not just a medical recommendation, it's your best defense in safeguarding your well-being and ensuring peace of mind for yourself and your loved ones. Sign 5. Increased urgency to urinate, especially at night. As we continue, one of the key symptoms that warrants your close attention is a sudden and persistent urgency to urinate, especially when it begins to interfere with your nightly rest. Many individuals notice they are waking up multiple times throughout the night to use the bathroom, a pattern that not only points toward potential prostate concerns but also gradually erodes the quality of their sleep. Over time, this constant disruption leaves you waking up tired and struggling with diminished energy levels during the day, which can impact everything from your work performance to your overall sense of well-being. What makes this symptom particularly concerning is that it extends beyond simple inconvenience. Frequent nocturnal urination can increase the risk of dehydration, strain your urinary system, and create a persistent feeling of discomfort that lingers throughout your waking hours. Moreover, this urgency can sometimes be accompanied by additional symptoms such as burning sensations, pelvic pressure, or noticeable changes in the color or odor of your urine, all of which serve as important clues about what's happening inside your body. Keeping a detailed record of these episodes, including when they occur, how often, and whether they're associated with other discomforts, can provide your healthcare provider with critical insights, helping pave the way for an early and accurate diagnosis. Addressing these signs promptly not only improves your quality of life but can play a decisive role in protecting your long-term health. Remember, the earlier you act, the greater your chances of managing prostate-related conditions effectively and maintaining your daily vitality. Sign 6. Weak or interrupted urine flow. Moving forward, one subtle yet crucial sign that should never be ignored is a noticeable change in the strength and consistency of your urine flow. At first glance, a weakened stream or occasional interruption may seem harmless, something many dismiss as a minor or temporary inconvenience. However, when this change becomes a recurring pattern, it serves as an important signal that your urinary system may be facing underlying challenges that require medical attention. You may begin to observe that your urine stream has lost its usual force or that you're experiencing a start-and-stop sensation during urination. These shifts in normal urinary patterns can point toward a potential blockage or inflammation within the urinary tract, frequently associated with changes in the prostate. What makes this symptom particularly concerning is its tendency to evolve gradually. Initially, it might feel like a small annoyance, but over time, it can progress into more pronounced and disruptive difficulties, affecting not just your comfort but your overall urinary health. Carefully monitoring these changes, including how long it takes to empty your bladder, whether you feel fully relieved after urinating, or how often you need to return to the bathroom, can offer invaluable clues for your healthcare provider. Addressing these warning signs promptly through medical consultation not only helps uncover the root cause, but can also prevent more serious complications down the line. Remember, acting early is one of the most effective steps you can take in safeguarding your health and maintaining your quality of life. Sign 7. Frequent urinary tract infections or difficulty urinating. Finally, at the end of our list but just as crucial, frequent urinary tract infections or ongoing difficulty with urination should never be overlooked. You might notice that infections seem to recur more often than usual and that these episodes are accompanied by symptoms such as a burning sensation, cloudy or foul-smelling urine, or even discomfort in the lower abdomen. Additionally, you may experience a consistent feeling of needing to urinate but find it challenging to do so. This could include straining during urination or only producing a weak stream despite having the urge. While these symptoms might initially seem like isolated issues, especially if they occur from time to time, their recurring nature could be a subtle hint that something isn't quite right with your prostate health. Paying close attention to these changes and noting their frequency and severity can be crucial. If you find that these urinary issues persist, it is important to consult with a healthcare provider to determine the underlying cause and take appropriate action early on. Thank you for joining us on this essential journey through the early warning signs of prostate cancer. As we've seen, recognizing these subtle but powerful indicators, from changes in urination to discomfort, pain, or other physical shifts, can make all the difference in catching prostate cancer when it's still treatable. Remember, early awareness isn't just about knowing the signs, it's about taking action when something feels off, listening to your body, and seeking medical guidance without delay. Your health is your most valuable asset, and staying informed is one of the greatest gifts you can give yourself and those you love. If this video has helped you gain new insight, or if you believe it could help someone you care about, please don't keep it to yourself, share it, Leave a comment with your thoughts, and let's start a conversation that could save lives. And most importantly, don't forget to hit that subscribe button and turn on notifications. By subscribing, you're not just following a channel, you're joining a growing community dedicated to empower people with knowledge, promoting early detection, and making health a priority. Stay strong, stay proactive, and remember, together, we can make a difference.